Zuranolone is a medication used to treat certain mental health conditions, specifically major depressive disorder. It belongs to a class of drugs known as positive allosteric modulators of gamma-aminobutyric acid receptors, which are neurotransmitter receptors involved in mood regulation. Indications. Zuranolone is indicated for the treatment of adults with major depressive disorder. It is designed to provide relief from the symptoms of depression and improve overall mood. How to use. Zuranolone is typically administered orally in the form of capsules. The recommended dosage is as follows. Initial dose: 1 capsule taken once daily in the evening for a total of 14 days. Maintenance dose: for some patients, an additional 14-day course may be prescribed to enhance the therapeutic effect. It's important to follow your healthcare provider's dosing instructions carefully. Your healthcare provider will determine the appropriate dosage and treatment duration based on your individual needs. Contraindications. Zuranolone should not be used in certain situations, including but not limited to allergic reactions to zuranolone or any of the capsule's components. Concurrent use with strong CYP3A inhibitors or inducers due to potential interactions. Precautions. Inform your healthcare provider about any other medications or medical conditions you have before starting zuranolone. Follow your healthcare provider's dosing instructions carefully and complete the prescribed course of treatment. Side effects. Common side effects of zuranolone may include sedation or drowsiness, dizziness, nausea, headache, insomnia or sleep disturbances, dry mouth. As always, consult a licensed healthcare provider for personalized dosing instructions and guidance. This information is intended for general understanding and should not replace professional medical advice.